You may decide to keep scrolling. However, if you want to know why I'm holding these two Asda lemons, then you should watch this video. Especially if you are a man between the age of 15 and 45, this is really important for you. Can you see what does this remind you of? What does this remind you of? Yes, your balls. Your balls. The first ball, the second ball, and the ball sack. And I am not just holding this for fun. I am holding this to pass a very important message across. Have you heard of testicular cancer before? Do you know how to examine your balls? If the answer is no, then I will be explaining things to you today. Testicular cancer, it's not a very common type of cancer, but it can happen to people, to men, especially between the age of 15 and 45. And what are the things to look out for? So there could be like a dull ache around the balls or in the lower belly. Some people could also have like pain in their ball sack. Some people could discover that their breast tissue is getting bigger, which really shouldn't happen in men. This is because testicular cancer can secrete or make some hormones, which makes the breast tissue grow bigger. Some people could also have back pain, and this can be very concerning because it may mean that the cancer has spread to the spine. And some people could discover that their ball sack or scrotum is getting bigger, or they could feel a lump around one or both of their testicles or their balls. So, what are the risk factors for having a testicular cancer? Any man especially between the age of 15 and 45, can have a testicular cancer. Also, people with family history of testicular cancer, then they are at higher risk of having testicular cancer. And there is a condition known as undescended testes. This happens in young males, especially when they are in childhood. If their balls do not come down into the ball sack, it remains around the tummy or in the pelvic region, then they could be at higher risk of having a testicular cancer. How do you prevent testicular cancer? The best way is to detect it very, very early by examining the balls. So let's assume this is one of your balls. How do you examine the testes? The way to examine the testes is, especially if you are in the bathroom, I recommend this once a month, to hold one of the balls, touch it. It should feel spongy, not too soft, not too hard, just spongy, a little bit softer than this lemon, to be honest. So just feel for anything abnormal. Is anywhere particularly tender? Is anywhere particularly painful? Any aches? Or do you suddenly feel that there is a lump? So a cancer lump would be hard. They will feel hard to touch. So if you feel anything irregular, anything lumpy, then that is concerning. So touch it. Then the other one also, you touch it and feel. Then you touch your ball sack itself also. You raise it up, lower it down, feel for any pain, any aches. If there's anything that looks out of place, then you should go and see your doctor immediately. When you see your doctor, they can do further tests such as an ultrasound, or they could request for some hormonal tests to check if you have testicular cancer. The key to beating any type of cancer is early detection. Now I can go have my lime.